Myelodysplastic syndrome. MDS is an idiopathic disorder that is considered pre-leukemic, in that a number of people go on to develop acute myelogenous leukemia, AML. MDS is probably from a genetic defect. The most common defect is 5q deletion or 5q. Most patients never develop acute myelogenous leukemia because complications of infection and bleeding lead to death before leukemia occurs. Patients are usually elderly and present with a pancytopenia, elevated MCV, fatigue, infections, and/or bleeding because of the low cell counts. There is a small number of blasts from 1 to 20% and, in fact, it is the percentage of blasts present that tells how close a person is to AML. 5q deletion is the characteristic abnormality of MDS. Patients with 5q have a better prognosis than do those without it. Presentation. Many patients present with an asymptomatic pancytopenia on routine CBC. Symptoms that do occur are fatigue and weight loss, infection, bleeding, sometimes splenomegaly. Diagnostic tests: CBC, anemia with an increased MCV, nucleated red blood cells, and a small number of blasts. Marrow. Hypercellular Prussian blue stain shows ringed sideroblasts. Severity is based on the percentage of blasts. 5q deletion has an excellent response to lenalidomide. Pelger-Ue cells are the most distinct lab abnormality in MDS. Treatment: transfusion, support with blood products as needed. Erythropoietin gives about 20% response. Azacitidine or decitabine lenalidomide for those with the 5q deletion can decrease transfusion dependence. Bone marrow transplant under age 50. Azacitidine decreases transfusion dependence and increases survival in MDS.